Okay, so today we're going to dive into chapter 4, focusing on diagnostic procedures and therapeutic interventions. Think of this chapter as building a toolkit you'll use every day in clinical practice to figure out what is wrong with the patient and how we plan to fix it. So, by the end of today's lecture, you should be able to confidently do two things. First, name the core vital signs and break down the four foundational physical exam techniques. Second, you'll be able to decode diagnostic and treatment words just by looking at their prefixes, suffixes, and roots. Vital signs are exactly what they sound like, sounds of life. They give us an immediate objective snapshot of a patient's hemodynamic status. Heart rate, HR, pulse. Note the physiological definition. It's the expansion and contraction of an artery as the heart pumps blood. RR, or respiratory rate. Simple count of breaths per minute. Always watch the chest rise and fall. BP, or blood pressure, the force exerted against the vessel walls. Temperature, or T, notice how many routes we have: oral, rectal, axillary, tympanic, which is the ear, and temporal, which is the forehead, artery via infrared light. Rectal is the most accurate core temp. However, there's a cost benefit analysis there because it could harm the patient. So you have to use that selectively, while axillary is generally the least precise. Oxygen saturation, short for peripheral capillary oxygen saturation, it tells us the percentage of hemoglobin loaded with oxygen. So, inspection, this is looking and listening. There is not a visual for this one. It starts the moment you walk into the room. Is the skin pale? Do you see a rash? The rash is also known as exanthem. Auscultation, that's image C. Listening to internal sounds using a stethoscope, mainly heart, lung, and bowel sounds. Palpation, which is image A. This is using your hands to feel texture, size, and location. For example, if a liver is enlarged, the medical term is hepatomegaly. Percussion, which is image B, tapping with your fingers or fists to evaluate the density or underlying organs or identify for fluid collections. Remember this rule: signs are objective, symptoms are subjective. A sign is something I can see, feel, hear, or measure. If the thermometer says 103, that is an objective sign. A symptom, SX, is what the patient tells you they're feeling. I cannot physically see nausea or touch pain. I have to rely on the patient's report. We categorize disease processes by their timeline and severity. Acute means rapid onset, short duration, and often severe. Think of a sudden heart attack, medically termed myocardial infarction, or a sudden onset of pneumonia. Chronic is the condition develops slowly and persists over a long period of time. Examples include COPD, or chronic obstructive pulmonary disease, type 2 diabetes. These disease processes require a long-term management. Time for a knowledge check. And also, as usual, time to take a brain break. So once again, get up, get a snack, step away from the computer, take a break. Look at the word parts here. Both contain the root nos, or nos. So that G is silent, which means knowledge. Dia, which means through or complete. Diagnosis, which is abbreviated DX, is using complete knowledge from physical signs, symptoms, history, and medical tests to pinpoint the exact illness, like identifying type 2 diabetes. Pro, before or forward, prognosis is looking forward. It's your forecast or predicted outcome of the disease. For instance, if our diabetic patient takes their medication and exercises, their prognosis is a long, healthy life with minimal complications. Let's build these words together using our word parts. Radio, radiant energy, graph, instrument or record. So a radiograph is an X-ray image. Tom, to cut. Computed tomography, CT, literally creates cuts or cross-sectional slices of the body. Opaque versus lucent. These two terms are vital for reading radiology reports. Radio-opaque substances block radiation, meaning they show up while white on a scan, like a bone or metal. Radiolucent means radiation passes right through them easily, so they show up dark, like air in the lungs. So this is just additional imaging procedures. Here's definitions here for those procedures so that you can read them. I don't anticipate that you will memorize each and every one of them, especially as you get into the clinical setting. The exposure to these procedures will help you to retain them and understand when they are appropriate for use. Now we transition from finding the problem to treating it. Let's master these roots. Excuse me. Algiso, pain. If we add the prefix "an" without, we get analgesic. So chemo, chemical, pharmaco, or pharmaceut means drug or medicine. Plast or plasto, repair or mold, as in a surgical repair. Tox or toxo means poison. Therapeutic or therapy means treatment. Let's combine our roots to understand clinical treatment terms. Cytotoxic, which combines cyto plus toxic, cyto meaning cell and toxic meaning poison. These are cell poisoning agents used to destroy cancer cells. Neoplasm combines neo, which means new, with plasm, which means growth, an abnormal tumor that can be benign or malignant. Anti-neoplastics are anti, which is against, plus neoplasm, which is tumor, medications designed to fight tumors. Antimicrobials or antibiotics, these are drugs that inhibit or destroy microorganisms. An OTC is an acronym or an abbreviation for over the counter. No prescription is required for these. Notice how all these words end in therapy, treatment. All you have to do is read the prefix to know how we are treating the patient. Radiotherapy, using radiation to target tumors. Chemotherapy, using chemicals to treat cancer. Cryotherapy, using extreme cold or freezing to destroy bad tissues or ease inflammation. Pharmacotherapy, treating an illness with regular medications. Thermotherapy, using heat to promote circulation and relax muscles. Here's a knowledge check. So these are the core text or curriculum pulls from. I highly recommend using the reinforcement activities connected with the Leonard textbook. And if you don't have access to that, also using the Google Notebook platform. If you need some extra or different types of reinforcement strategies, just email me.